Aloha mai kākou. Happy Aloha Friday. Welcome to Huewai Ola. My name is Kale Chang. It's my pleasure to be your host. Huewai Ola is a webinar series brought to you by Ahakane and Kanaeokana. It's a wonderful opportunity for us to strengthen our ohana by uplifting and empowering our kane, our Hawaiian men. Huewai Ola means a gourd of living water, referring to a man as a vessel of life guided by the god Kane. In Hawaiian culture, gourds also represent knowledge. In this series, we'll be introducing you to some extraordinary people, cultural practitioners, scholars, and leaders in our community. They'll share their perspectives, practices, and advocacy in our lahui. We'd like to say aloha nui to our viewers out there. Mahalo for joining us today. As we get started, please shoot us a quick aloha in our Zoom chat box or Facebook comments, and let us know where you're joining us from. Also, feel free to leave comments or questions, and we'll do our best to make you a small part of our conversation today as well. Welcome to episode 21 of Huewai Ola, COVID-19, Prevention, Treatment, and Recovery through Naturopathic Medicine and Traditional Hawaiian Healing. We're very fortunate to have with us two Native Hawaiian kauka. Please help me welcome Dr. Landon Opunui and Dr. Kamailani Boyd. Aloha mai kākou.
Aloha.
All right. I know both of you have wonderful presentations to share with us and some great information for our community. But before we do so, can each of you just take a quick moment and kind of introduce yourselves to our audience? Landon, you can go first.
Aloha mai kākou. My name is Dr. Landon Opunui. I am a naturopathic physician by license and training. Been in practice for 7 years. I am the recent medical director of Napu'uwai, Native Hawaiian Healthcare System, serving the islands of Molokai and Lanai. And I am honored to be a part of this platform and share a very important, exciting story with you folks today.
All right, thank you so much for being here this afternoon. Kamailani?
Sure. Aloha. Aloha wakea kākou o Kamailani ko inoa. Ke noho au ma kahalu i ke ia manawa, ke kumu au ma ke kula kaiapuni o ke ko'olau poko ma Windward. I teach nursing and I manage an organic medicinal garden. I am a holistic, board certified holistic nurse practitioner, also board certified family nurse practitioner. I'm a Native Hawaiian health scholar. I graduated in '99, but still continuing my commitment to care for Native Hawaiians. I own and run Kaluahine Therapeutics, a business of body works and botanicals. I have 4 children and expecting grandbaby number 12 this month and 2 great-grand. Happy to be with you all.
Wow, thank you so much for sharing a little bit about yourselves. Thank you for being here today. I love this platform of Huewai Ola because we get to look at things like COVID-19 from a very Hawaiian and cultural lens. And so to our audience out there, that's exactly what we're going to do today. We're going to take a look at COVID-19 from a medicinal standpoint, a cultural or Hawaiian standpoint, and also possibly through the eyes of a patient. So I believe, Kamailani, are you going to kind of start us off this afternoon?
I can start to introduce the 2 cases and then Landon will present his case first.
Okay, great.
So yes, aloha everyone. We'll start off, I guess I'll put mine so that we can start off with Puliakahaku first, Mamua Oke Kamalio. So we have decided to present 2 COVID cases. Landon will present an individual, a man who is pre-COVID and likely at greater risk for getting infected because of everything he's going through in his life now. And I will present a gentleman that did experience COVID and was hospitalized in Hawaii and is continuing his journey toward recovery at home.
All right.
Oh, there we go. So we will say the pule, we put it up for everyone so that you could please join along with us. A pule kako. I ko mako makua I loko okalani e ho ana ia
ko inoa.
e
E
hiki
hiki mai
ko
ko ao puni
e
e
malama
malama
ia
ia
ko
ko make ma ka honua nei.
e hiki me ia I malama ia ma kalani la e haawi mai
Ahi
ha
mai ira
kuru
mako
I ia
ka ia
la
la ia na
na
mako
mako
no
me
nei
ia
la.
la e kala mai
Kala mai
ia
hoʻi.
mako I ka mako lawe hale ana me mako
Mako e kala nei.
I ko I lawe hana
Mako.
ko mako mai hoʻoku o ia mako I ka hoʻowalewale ia mai e hoʻopakele no nai
Ia mako I ka ina.
ia mako no ka ino e no ka mea no ke aupuni a me ka mana a me ka hoʻonani ia a mauloa aku amene. Sorry about the different levels.
Amene.
Wow. Go ahead, Landon.
All right, mahalo again for the opportunity to share this exciting presentation. As Kale mentioned, it is a unique perspective on COVID-19 that has not been discussed too much in the mainstream and in the public eye. And before I talk about my case, which again is focused on the prevention of COVID-19, as well as the flu season as we approach flu season as well, I thought it might be first appropriate to talk a little bit about naturopathic medicine and what I do, as many of our audience might not be familiar with my profession. So naturopathic medicine is a medical career that follows 4 years of pre-med undergraduate studies, followed by 4 years of medical training, very similar to medical doctors and osteopathic physicians. We learn the basic sciences, anatomy, physiology, biochemistry, etc. And then we also learn many of the standard of care approaches for treating various health conditions. And the one thing that really kind of separates naturopathic medicine is our principles. And a few of the principles that I wanted to touch on today were, of course, prevention. That's kind of the core emphasis of the story that I hope to share with the audience. Health promotion, treating the root cause of illness, using nature as a powerful healing entity, teaching patients. The word doctor actually comes from the Latin word docere, which means to teach, to treat the whole person, and then lastly, to do no harm. This is a diagram that I like to use that represents the ike of each of the different healing and medical modalities. So here we have a circle representing traditional Hawaiian medicine or healing. We have a circle representing naturopathic medicine, and we have one representing Western medicine. And I think, especially in today's day and age, it's so easy for us to first start off with the differences. And I think it's really important, especially in today's day and age, that we reshape the way we think about the world. And we first start with the things that we have in common. Where are our shared goals? And as you can see in this diagram, the one area that overlaps all of these different approaches to health and healing is the commitment to the patient. So it's really important that we first honor that there are different ways to see health, there's different ways to treat and support patients, but all of these various approaches, again, are committed to serving the patient. The overlap that naturopathic medicine and Western medicine has is we have many of the same evaluation processes. So I order labs, I order imaging, I do physical examinations on patients, very similar to what you might expect going to a medical doctor. Many people also don't realize this, but naturopathic physicians are trained and licensed to prescribe medications. So there is a time and there is a place for medications. And although that is something that is usually a later resort for me, it is something that both NDs and MDs have in common. The commonality between traditional medicine practitioners and naturopathic medicine is the emphasis on natural medicine. One thing that many people might not know is that naturopathic medicine is actually an extremely small profession. We have about 100 licensed NDs in the state of Hawaii, compared to about 1,000 osteopathic physicians or DO, and just under about 10,000 medical doctors. So my profession, I believe, this is my bias, we have a very important place in healthcare, and I hope that more of us can step out into the mainstream, such as platforms such as these, to really share what we can offer our community. Integrative healthcare is a new approach that Na Pu'uwai has recently developed. And one very quick, simple definition that I often like to share with those individuals who might not be familiar with more of an integrative medical approach to care is one of the right medicine for the right patient for the right time. It's important that we have many tools at our disposal to help support our patients wherever they're at, so that we can touch as much of our community as possible. So this is what we are trying to accomplish with our healthcare system at Na Pu'uwai, and will be represented in the stories that Dr. Boyd and myself share today. So my first case, I'm gonna dive right into it. Kawika is a 42-year-old Native Hawaiian male who zooms in for a new patient visit with the goal of, I don't like get sick. During his last annual physical exam about 9 months ago, his primary doctor diagnosed him with elevated blood pressure, elevated cholesterol, and prediabetes. He's also carrying about an extra 40 pounds, likely because, in his words, he's eating too many plate lunches. He was recommended to improve his diet, exercise more, and was prescribed a blood pressure and cholesterol medication, which he never got around to starting because he was too busy. His primary job is construction, which he does during the day, but he has recently started a side job where he works security 3 evenings a week because his wife got furloughed as a Hawaiian Airlines flight attendant, who is now at home taking care of their 2 kiki, ages 7 and 9. Kawika feels worn out, tired, and is worried that he might be putting himself at risk for contracting COVID-19 as the cases and deaths on Oahu continue to climb. This is a major concern for him because he is currently the sole provider for his ohana. Because of his high stress, he copes with vaping tobacco and cannabis. He believes he can do more for his health other than just washing his hands, wearing a mask, and social distancing, and is asking for some support. So again, in summary, the main reason why he came in to see me, he's interested in preventing COVID-19 as well as the flu. He has a couple of chronic health conditions, very high stress right now. He has limited time for self-care. He's vaping tobacco and marijuana. He might have an addiction problem there. He is eating poorly. He's not sleeping very well, and as a result of that, he tends to be a little bit more on the angry side. He has financial concerns, and lastly, he has a fear of getting sick. So when it comes to prevention, this is the mainstream narrative that many of us are hearing. The 3 W's is what many of us have heard. Wear your mask, wash your hands, watch your disease. Now there's going to be another W that is going to be hitting the mainstream very soon, and that is, what are we going to be doing about the vaccine? Right now we're waiting for the vaccine, but when the vaccine comes, what are we going to do about that? And although these are all very, very important things for us to be mindful of and practice as best we can, there still remains a question. Can we do more than just this? And my answer is emphatically yes, absolutely we can. So this is the untold narrative. How can we modify our diet in such a way where we can make ourselves as resilient as possible? What are some of the other lifestyle things that we can start incorporating into our daily lives? How can we better manage our stress? What are some of the natural medicines that we can consider to help boost and make our immune systems more resilient? Because smoking and vaping is an incredibly high risk factor for COVID-19 complications, why not focus on promoting the quitting of smoking as something we should be doing from a public health perspective? We should also be managing chronic health at the same time, because we also know that carrying a little bit of extra weights, having diabetes, having heart disease, having cancer, a lot of these conditions are actually major risk factors for COVID-related death or complications. So before I get back to Kawika and some of the recommendations that I have specifically for him, I just wanted to start off with a very broad brush and talk about some very simple strategies that we can take to prevent illness. So the first, of course, is aipono and the immune system. So we know that a whole food diet provides the immune system all of the supportive nutrients necessary to work as optimally as it can. So what are some of the simple things that we can do right now? Well, we can stop eating the foods that make us weak. This is something that I commonly like to use with my kane patients, because men don't like to be weak. And there are many things in our common Western standard American diet that makes us weak. The first of which is ultra processed foods. I was shocked when I heard this statistic, but 60% of the American diet consists of ultra processed foods. That's more than half. So if we get that stuff out of the diets, we're gonna put ourselves in a much better situation. Industrialized oils, especially used to fry our foods, we should definitely consider cutting back on those things. Factory farm meats, and then lastly, we have our refined carbohydrates, things like our sugary beverages, things like our breads and pastas, have all of the fiber and many of the nutrients stripped from it. So what are we left
I'm sorry,
with?
Landon. Can I interrupt you real quick? Could you give a couple examples of the ultra processed foods as well?
Sure. Well, all you need to do is go to any grocery store, and it's essentially all of the food in the center of the grocery market. It is the food with multiple labels in it, many of which are unrecognizable, and are essentially small little molecules that they put together to create something that I call a food-like substance.
Okay. Thank
So
you. Sorry for interrupting.
no problem, no problem. So what are we left with? We're left with real food. And on top of eating real food, we should also be mindful about not eating too much of it. And the staple of our diet, just like the traditional Hawaiian diet, should be mostly plants. Movement and the immune system. This is me in my va'a. As we are all aware, many of the gyms that we commonly go to are closed right now. So this is my main form of exercise right now, and I love being out in the water as much as I can. So we know that exercise is very powerful for helping to optimize our immune systems. And when it comes to exercise, it's important that we're mindful of the sweet spot. So we can't do too much, but we also need to do something. So we want to be somewhere in between those two extremes. And when we do that, we put ourselves in a situation where our immune systems are likely going to be as healthy and strong as possible. So some of the tips that I commonly recommend for my patients are to find opportunities to move. Many of us are really busy with work, sometimes multiple jobs, raising families, and taking care of parents. So when in our day can we find an opportunity to move? maybe first thing in the morning, we can wake up an extra 15 to 30 minutes and go for a walk around our neighborhood. Or maybe we can set an alarm on our smartphone, and at the top of every hour, we can do 5 push-ups, or we can do 10 jumping jacks. So there are many, many opportunities throughout our day where we can move, and I encourage everyone to take advantage of that. Hawaiians did not have a word for exercise. So movement is always going to be my preference for patients over exercise, because we can exercise for 30 minutes a day, but if we just sit back down and work on our computers, that carries with it some risk. So we want to move consistently throughout the day as much as we can. We also want to keep in mind that movement is an extremely powerful mood medicine. And right now, our moods are taking a hit right now. We're exposed to so much negative news around us that the simple act of moving regularly can really help us balance our minds out a little bit. And then lastly, my favorite, I love moving outdoors. I think that equates to exercise squared. It checks so many of the boxes. So whether you're going on a hike, whether you're working in your garden, whether you're out in the ocean like me all the time, that is a much more effective means of movement. Stress and the immune system. So both acute and chronic stress can result in suppressed immune function. And this is something that we all need to be very mindful about right now, because many of us right now are dealing with extreme states of stress. So what can we do? Very simple stress management technique that I teach many of my patients is the 5.5 breathing technique. And it's very simple to do. For 5.5 seconds, we breathe in. For 5.5 seconds, we breathe out. And we repeat that 5.5 times per minute. Very, very simple, very, very effective. And if you're in a state of stress and you do this, I can almost assure you that within a few minutes, you're immediately going to feel more grounded, more centered, and more at peace. Another very, very simple strategy is practicing gratitude. There was a really fascinating research study that showed that writing down 5 things that you're grateful for once a week increased happiness by 25%. How simple is that? It might take you a minute once a week, and it'll increase your happiness by 25%. And then lastly, I really encourage us to refocus our attention, because where we focus is what we feel. So if all we're doing is scrolling through our social media feed, if all we're doing is waiting until 12 o'clock every day to see the new case numbers of COVID, we're likely going to feel a little bit more anxious. But if we focus on our health, if we focus on our ohana, if we focus on learning new cultural things, that all of these fantastic webinars that we're exposed to, we're likely going to feel a lot better about ourselves. Sleep and the immune system. So we know that shorter sleep durations increase the risk of infectious diseases. Sleep is very, very important, and sleep consistency is key. So we want to go to bed at the same time, and we want to get up at the same time every day, 7 days a week. Another concept that I'm a really, really big fan of is something called digital sunsets. And what that means is that when the sun goes down, all of the electronics go off. So that's the computer, that's the smartphone, that might even be the television. And what happens? Your immune system or your stress immediately calms down, and it gives you more space for social interaction with your family. So it's a great way to unwind at the end of the day, and it prevents us from getting blasted with blue light, which is emitted from all of these devices, which actually make it very difficult for us to get deep sleep. If those strategies aren't enough, there are many fantastic sleep support la'au, chamomile, lemon balm, lavender, ava, magnolia, passion flower are some of the favorites that I commonly recommend for my patients. So one of the unique things about naturopathic medicine, again, is the use of evidence-based botanical medicine. So the recommendations or some of the evidence that I hope to be presenting with you over the next couple of slides are heavily science-based. And what I hope to do is kind of break the different herbs into a couple of different categories in relation to their role in preventing COVID-19. The first of which is blocking the coronavirus from entering the cells of the body. The second is to decrease the virus replication. And then lastly, the third strategy is to enhance our immune function. So this is a really complex graphic, but what I wanted to make everyone aware of is that this little circle looking thing is the virus. And when we are exposed to the virus really isn't problematic until it gets into our cells. So the virus enters the body, then gets transported into the cells of the body. That's where the complications happen. And the reason why the virus continues to be spread, and the reason why many of us really struggle with this particular superbug is because the virus replicates really, really fast. So it spreads really, really quickly, and we have many complications as a result of this very rapid division of the virus. I should have started with this at the very beginning of the presentation, but I also wanted to quickly plug in a quick disclaimer. I am not giving any medical advice during this presentation. It is purely educational. So please go see your doctor before doing any of these recommendations. Now, with that said, here's another disclaimer that I think is really important for many of us to hear. There are no integrative treatments that have been validated in human trials to be effective for the treatment of COVID-19. So the herbs that I'll be presenting the audience with over the next few slides are theoretical in their benefits and all fall into one of these four categories. And the category that I tend to recommend my patients consider are the ones in this green box. So these are the treatments and the herbs and the nutrients that have a high likelihood of benefits, but are very, very low in their potential risk. What we want to avoid are things that likely don't have much benefit and are likely to also pose a really high risk. So this red upper right corner box is what we want to stay away from in terms of medicine that we might consider during these difficult times. So again, the first mechanism for prevention is to block the virus from entering the cells of the body. And there's a couple of things that are very effective at doing this. The first of which is astragalus. Astragalus is a Chinese herb, and the root is often used for the medicine. Quercetin is a colored nutrient found in onions and apples, also has this effect. And then lastly, vitamin D is also very effective at this. And one of the plants that are highest in vitamin D are mushrooms. I'm a very, very big fan of mushrooms for multiple reasons. What you see depicted here is what we call a tincture. So this is an alcohol extraction of an herb, and we take the tincture liquid because it holds a lot of the medicinal properties of the plants. The second mechanism of prevention is blocking the virus from replicating. What you see depicted here is another one of my favorite herbs. This is elderberry. Many patients love this one because it tastes absolutely delicious. It usually comes in the form of a syrup, and it's really good for kids. And because it's a liquid, it's really easy for the entire family to take. Zinc, which is a mineral, also has this viral blocking property as well. And then lastly, we have here improving immunity. Two things that I'll present have this property, and that's vitamin D again. And then lastly, we have medicinal mushrooms. And no, these are not the ones that make you hallucinate. These are the ones that help to modulate the immune system. What you see here depicted is one of my favorite mushrooms. Its Latin name is Coriolus versicolor. Its common name is turkey tail, and it's absolutely beautiful. I went to naturopathic medical school in the Pacific Northwest, Seattle to be specific. And one of the hobbies that I picked up was mushroom hunting. And I would just love coming across this particular mushroom because I thought it was absolutely beautiful with all the different colors that it possessed. So back to Kawika. There's a couple of questions that I like to think through before I make recommendations for a patient. And the first is, what is your assessment of Kawika's health challenges? What are some of his health barriers? How would you support Kawika through the lens of my training and my experience? And then lastly, what would I do to prioritize, or what would I suggest to prioritize with his health? So this is a very important concept that I like to introduce to patients, and it's something that I would try to use in my education of Kawika. And that's a health spectrum. And as you can see here, health is extremely complex, and we have two extremes. On the far left, we have terminal health. So we have a patient who has many health conditions, and they might be approaching death. And then on the other side of the spectrum, we have optimal health. We have someone who is free of chronic health conditions, has a healthy body composition, is mentally really healthy, emotionally really secure, has many social connections, and is really thriving. And then we have everywhere in between. One of the challenges in Western medicine is more of a reduced perspective on health. And that is, we are either healthy or we're not healthy, meaning we are either have a diagnosis, we have a health condition, we are ill, or we're not. So it's more black or white in that perspective. And I think that is a challenging perspective when we are trying to help prevent patients from developing a lot of those chronic health conditions. So my bias is that we can intervene at any point along this health spectrum. And where Kawika is right now is where this A is depicted. So he kind of has about average health. And to be honest, average health usually means that you have a couple health challenges that you're struggling with. But where he wants to get is he wants to get to point B. And there's a wall, and there's a barrier in his way. And some of those barriers are he's working too many jobs. He's stressed out as a result of that. He's not getting enough sleep. He's coping with his stress with cannabis and tobacco. And all of these things are preventing him from improving his health and putting him in a space of becoming more resilient if he were to come in contact with COVID or the flu. So there's a lot of things that I would recommend for Kawika, and I would love to carve out a little bit of time to have Kamailani share what she might recommend from a traditional healing perspective. But the first place that I like to start, especially with my Kane patients, is normalizing some of the challenges that he's experiencing. This is a really, really difficult time for many of us. There is so much that is out of our control right now, and it is extremely hard to navigate the environment that we find ourselves living in today. So it's important to acknowledge the fact that, man, you're really having a tough time right now. I see that. And then it's also important that we honor Kawika's commitment to improve his health. And you know, many men in particular have a very difficult time asking for help. And just the courage that it takes to schedule an appointment and to come in to see me is something that I really would want to honor for Kawika. The next place I like to start are what I call the 3 M's, and that's mindset, that's motivation, and then it's methods. So going back to this picture, Kawika wants to go from A to point B, and if he has a mindset that believes that this wall is too high and that he is not going to have the ability to improve his health or find a way to put him and his ohana in a better situation, it's very unlikely that he's going to get there. So it's important that we work with him on the mindset that he can do this with some support and some guidance. So again, it starts with mindset. Motivation is our energy. So if we want to change our behavior, if we want to improve our health, we need to do so with focus and we need to do so with energy. And all of the things that I just talked about, dialing in the diets, moving our bodies, sleeping well, breathing well, managing our stress, getting a handle of that, are all things that empower energy within us. And the more energy or the more mana we have, the more motivation we tend to have. And then finally, there's many, many different things and many, many different approaches that we could take for Kawika. We want to try to simplify things for him as best as possible and come up with some very simple steps and methods for him to start improving his health. So I already talked about this concept of digital sunsets. So I encouraged him to consider that. Put the phone away, turn off the television, play some games with the ohana, cook dinner together instead of watching movies and scrolling on Instagram. Secondly, I recommended him to consider stopping at Roots Cafe. This is an awesome plug for Kokua Kalihi Valley on Tuesdays and Thursdays, and get a aipono lunch. And on the other days, perhaps he can consider bringing lunch from home, and at the very least consider cutting back or stopping completely all of those sugar sweetened beverages, the Hawaiian Sun, the energy drinks, the frappuccinos, as again, those are just poisons. They make us weaker and they are very detrimental to our immune health. I recommended and encouraged him to consider a smoking cessation program. Again, he's concerned about the complications of COVID. So he is, because he's smoking, that is a huge risk factor and something that he can quickly and immediately address. Because he's working 2 jobs, I thought we could introduce him to some resources to provide him with some rental assistance. He set a goal for himself of losing 5 pounds over the next month. And then in regards to the medicine, I gave him a tincture of reishi and astragalus and some elderberry syrup to share with the family. And then lastly, I referred him to traditional healing. For all those viewers, this is another plug for another great resource through the Council for Native Hawaiian Advancement, the Ho'ala Assistance Program, which is which helps with mortgage, rent, utilities, and you know, many people will qualify, including Kawika. So definitely something for all of us to be aware of. And with that said, I'll turn it over to Kamailani if she would like to add any additional thoughts.
Thanks, Landon. Wow, really nice, right? Those are real people. It might have been a fictitious case, but I know we've each actually seen people just like that. So I guess I would ask you if you recommended any magnesium. I don't know what kind of tension, stress, pain there is in the body that on the naturopathic side, some other minerals that could help. Selenium could also help with rest. And then on the traditional side, I would encourage prayer. Ho'oponopono, and who's in his district, who comes from his church. who his family works with to see what other issues there may be. Some of it we can strengthen up, and body work. So we'll be talking about that.
All right, Landon, thank you so much for sharing that presentation. First of all, your example, Kawika, couldn't be a better representative of just like, I feel like I'm that guy, you know, of our just members of our Hawaiian community. I love the simplicity of looking at movement versus workout, the benefits of just a better attitude of gratitude and just practicing the simple task of breathing and being centered. And it's just crazy how synonymous naturopathic solutions are to just how we view the world from a Hawaiian perspective as well. So very simple and very, oh, what great information. This is wonderful. So if you're watching this later and you can pause and repeat and watch the first half of this, go back and take notes and then continue back from this point. Thank you so much, Landon, for sharing that.
Thank you, Landon. Do you want me to share the screen?
Yes, please.
Okay.
Oh, while she's doing that, Landon, I had one question about people interested in finding those teas or tinctures for or the elderberry.
Sure, it's pretty easily accessible online or at any of your local health food stores. What we try to do at Napu'uwai is make as much of our medicine locally available through our clinic as much as possible. So that's one benefit of seeing a provider, to be able to source some high quality plant medicine.
Ah, nice. Thank you.
Aloha. Can you see the screen?
Yes.
Okay. So, aloha, everyone. I already introduced myself. So this talk, let me move this over. Ho'oholu, ke'olakino, we don't have, Landon mentioned that we don't have a Hawaiian word for exercise. We also don't have a Hawaiian word for health, right? Health is the compilation of everything that we are in this vessel. So includes the spiritual wellness, the physical wellness, the social wellness, etc. Ola pono is one way to say good health, ideal health. So this presentation, Dr. Leo Pasqua is a pediatrician who works and lives on Oahu, and he had the great misfortune of contracting this illness and was hospitalized. He's also in this space with us today and is available to join us online in the Zoom if anybody has questions when this is done. So if anybody has questions, just remind me to pop Dr. Pasqua up.
Oh, nice.
Oh, okay. Okay. So we already did the pule at the start. I just want to take this time to acknowledge the ancestors from above and below, those to each of my sides. Au hema, au kau, mamua, mahope. I could not do this work without the many people that have invested in my training and my living in this Hawaiian Huewai Ola path. Okay, I don't know how, okay, let's see. Oops, oh, that's not good. Sorry.
No, no problem.
Okay, we'll get it back. There you go. I see the arrow now. Here we have Leo Pasqua. March 12th or so, he went to New Jersey. He said he wanted to go to his daughter's engagement. Got to New York, and in talking to him, right, in Hawaii, we were still talking about what China was going through and not really talking about it in the sense that this is going to be real for us at our front door, right? Such that he believed he could go to New York. So he goes to New York and he finds that there's a very different animal there, right? And they've even closed down Broadway. because there's just so much sickness spreading fast, people dying by the thousands. We're seeing on the news after that, you know, that some hospitals have 18-wheeler trucks, air-conditioned or refrigerated trucks, just to have a place to store all these bodies. So he starts feeling bad. He starts experiencing a decrease in taste and smell, starting to have difficulty breathing. So he returns to Hawaii and asks a colleague, hey, can you write me a prescription of some really hardcore antiviral so I can knock this thing out? And he actually gets worse, right? So he gets admitted, he's in ICU, and much to his horror, they're now talking about a DNR, which is a do not resuscitate, which means that if you get close to the end, CPR will not be done for you, right? And in this advanced stage, there was some reports of hospitals making it mandatory that you would be put on a DNR because you can't really do a CPR without more touching and a possible exchange of fluids, right? So he spent 10 days on the ventilator. Thankfully, thank God, after that, he was still hospitalized for another 2 weeks, but on the regular floor. This kind of fear that everybody that comes near you is in full protective gear. You have not seen your family. You have not had any visitors. The only time you see your family is when one of the staff has time to put you on FaceTime, right? So he gets discharged home after his first COVID test is negative, and he's to complete his testing there. Oh, and by the way, his whole family also tested positive, and they were able to care for themselves at home, to quarantine at home, and to recover at home, but he wasn't as lucky. He was put on temporary disability for 3 weeks, still recovering at home. Finally, his primary care provider, or PCP, gives him approval that neurologically and cognitively he's functioning to a level that he can maybe return to work now. And so then after his second COVID test is negative, he's allowed to return to work.
Sorry, Kamailani, did you mention his age?
Oh, sorry, e kalama ia'u. So he's 60 years old, he's married,
Okay.
he has 2 children, and he works as a pediatrician.
Wow.
I've known him since the mid-90s. So now he's home. From the traditional point, we start with aha'aina. So aha'aina can be very small in your home with your wife and your keiki, and it can also be very big. I have seen it last 4 days, and I have heard it last longer. So we want to use this initial time that you come home as much as your health can allow. And as Landon was saying, right, to build back up the immunity, to start to recover, to nurture kekino, right? Nurture uhane, to nurture spirit. So there's wailani. This middle picture, vailani, the rain that comes down and is captured on the lau or different leaves and is then filtered. I capture this water and keep it in a bottle in the fridge. It's especially important to me when I make the medicines for the very young and the very aged, or those who have recently recovered from significant illness like Dr. Pasqua did. And then there's just a list of the other kinds of whole foods. Same thing Landon was mentioning. And you can get limu so strong in iron, and Hawaiians knew just from observation that the body heals well when it has limu or alaya, right? A red dirt that is also high in iron. And by the way, it's high in iron as evidenced by the redness because it rusts. The rain, the ua that mixes with this iron in the soil causes this rusting effect. And of course, poi and maia and all of the other family members that are now joining us at the table. So ke ki'i mili mili, how do you work with the body? And I should say that depending on where you're trained on the various moku, you may use some different words or some different terminology. So e kalamaya'u if this is not the way you've heard it, right? So ke ki'i mili mili to touch the body and start to assess. So ola kino and na piko, right? Piko manava, piko opo'o, piko vaina, and piko ma'e, piko manava. Are your connections to those before us, are those strong? Have you prayed? Have you asked? Have you forgiven? Have you asked for guidance? And to the next generation, are you considering your immune health now? You carry all the seeds of the future. What you feed, what you eat now, feeds them. What you pray now, heals them. So we start now understanding how we are aligned to the three Piko. And to Piko Vaina, to our parents now, and how do we honor them and those teachings that they have given to us. For me, right, there was always poi on the table, pa'akai, dry aku, canned salmon with those little kind of shower cap rubber plastic things, right? And I would say, oh, you know, I want to eat some more. And my tutu would say no, because it's so shame, right? Hila hila, if somebody comes and there's not food on the table, oh, well, we have some more food in the cabinet, I would say. We can eat this food that's on the table and we can get some more out of the cabinet. But she would say, no, it's the food that was prayed and prepared. That when somebody comes, there's already food there, right? That's part of the prayer of the house. And the Pico Vaina, that I had learned this from the current generation, right? Nanaina, all the visual changes, are there any blurriness or anything like that? Pain in the eyes, any kind of floaters, any kinds of things like this we would want to assess. How about lohe, hanu, hoa'o? How do you hear? How is your hearing? Is there any ringing in the ear? How is your breathing? How is your tasting? Any of these kinds of things I want to know. Ake paha ola, how is it with the health of the lungs? So he kunu, any coughing? He kuha, any mucus coming? Any wetness? He umi, hey, any shortness of breath, any kind of pain here in the chest, right? Manawai, all of the circulatory system. We don't really have a Hawaiian word for cardiac health, but we understand that the circulation of the fluids that move in the body, much like, you know, punawai, much like all the rivers, streams, ponds, and ocean, we are much connected to the water and understand the body system, the cardiovascular system as manawai. So any chest pain, eha umauma, any pehu ika waiwai, or vai, any swelling in the leg, right? When the heart has been attacked and has gone under some stress, its ability to move the fluids through the system is hampered, and we can see that as evidenced by swelling coming to the legs. Namea ho'ovali. So also, this is our terminology, namea ho'ovali iloko. All of the matter within the intestines and within the abdominal cavity, all of the digestive organs and processes fall under this area. So do you have any nausea, any diarrhea? What if you have constipation, right? So as we move to thinking about cleaning the body, we want to know, is the current body toward ku kai pa'a, toward constipation, or palahi, or more toward diarrhea? So we don't want to just cleanse. We want to cleanse the body that you are living in, the vessel that you're living in, and what that experience is like for you. Ililoli, what about the skin changes? Are there more dry? Are there any cracks? Are you easy to bruise, easy to get sore? These kinds of things. So kui are all of the joints, and there are many words for all of the various different joints. Is there pain in the joint, and does that joint come from the EV, from the bone, or does it come from the muscle, right? So you need the body work. You need the lomi to feel where things are trapped, where there's stagnation inside the body. Kea'a, So A'a is the word used for the neural system that mirrors the root of hala. A'a is also the word for your closest relation, right? The neural system, you get one little piece of hair that touches you somewhere, right away you know about it. We're not conscious of everything that's going on around us. There's lots that the neural system is taking in and dealing with that we don't even pay attention. Even when you move the hair away from your eyes, you may not have even known you did that. The neural system just knows it needs to be done. And then finally, with the kaumaha, right? So what is hoi hoi? What is your worry? What is your anxiety? What is your frustration, right? Hopo hopo. So still anxiety, fear, apprehension, pensiveness. Um, there's just so much going on. You've been very sick. You've been in the hospital. And what if you get it again? What if you go home and you give it to your wife and your kids, right? There's just so much going on in the mind right now. Uwe, are you spending time crying? Do the tears just come? When we've been sick, next thing you know, you don't even know why you're crying, right? Patients will say, I don't know why I'm crying. I'm telling you my story, but I don't know why I'm crying. Hoo-hoo, are you becoming now, you just want to grumble about everything. Everything irritates you. You're so short-tempered because you've been sick, right? But then the family is like, look, brother, we put up with you gone in the hospital a long time. Now you're coming home. We like you to be normal. We don't want to hear hoo-hoo, this kind of, right, namu-namu, any kind of complaining. And are you acting pupule? Right? Are you making decisions and doing things that you just normally wouldn't do, out of the ordinary for you? And you may not be aware of this. It may be your family members or your coworkers or somebody at your church that says he never used to do that, and now he does that. And it may be a good thing. So when you talk to the client, when a client comes to me, they mostly know exactly what's going on, or they have in their mind their own belief of exactly what is going on. So yes, pi hoi hoi kana'au, right? So you may have some apprehension, but the healing person in you, the ancestors in you, the aumakua around you know what you need to do. And so when I talk to this patient, like what are the tools? What are the tools that all the powers around you, the plants and the ancestors, and your experience, what tools do you have now? He describes to me, he's understanding the disruption of operations. I'm not the head of the household right now. I'm not the head of the clinic. I'm not premier pediatrician, right? I'm a sick person recovering. The mental siege, all the emails, the commercials, the everything just about COVID. And here we are again today talking about COVID some more. Information conflict, wear a mask, don't wear a mask, go outside, social gather, don't gather, right? Causes more kind of pupuli in the head. This dystopian kind of lifestyle that has no value for social justice, where the poorest people get hit the hardest, and our leaders are not maybe to our liking or to our need doing enough for those people most likely to suffer the most. Financial consequences, political viewpoints, biological uncertainty. You're negative, but now the news is saying you may not have permanent immunity, and others around you may not have passive immunity, right? The language is constantly changing. At one time they said don't wear a mask, it's not going to help anybody at all. Now they say you must wear a mask. And the global fluctuations on what any country is doing at any given time. So here is his ike, his toolbox. He wants to be engaged in profound conditioning of the brain. So he's reading and exercising that muscle in the brain, and he's writing. He shared with me his journal, pages and pages of writing his thoughts just as they flow. Master the bizarre, right? You're the only way you can communicate with your family is on FaceTime. This is bizarre for you. Engage in the audacity. If you're going through hell, keep going. You're likely going to come out on the other side. And by the way, these are all his words. Celebrate the decline toward death. As Native Hawaiians, we don't fear death. Our ancestors are on the other side. We welcome a chance to reunite with them. So if that is where we're going, pule that, right? Then be your own champion, much like Landon was saying, right? Seeking preventative measures so that you don't get COVID. And if you did, you're going to power out and recover. Honor the mind's ability to augment itself. Rebuild yourself stronger than what you were before. And he kept dreaming this song he was working on for a church performance. And a line within the song was, "Be not afraid." And he reports that during his entire hospitalization, this phrase kept coming to him, and he believes helped pulled him through. And the picture in the back of this slide is my way of visualizing his story, because he says to me, everybody came to me, the ancestors, the Aumakua, the current friends, the current church members. They came to me, grabbed me by my ankles, and were pulling me back, were pulling me to health, were pulling me home. So when the patient says to me, whatever your story is, I visualize that experience of what you're doing and how can I do that when I see this person, right? But now he's on the other side and he describes himself as the puller. He was the pulley, but now he's the puller. And because of his blessings to have survived so well with so much supports around him, he has now taken on the hana, the work, the responsibility to leave it better than it was, right? When he got COVID, people might have been alone, but he is now doing big work to change that for others behind him. So then we would ho'omai. So now I know his toolbox. I see his picture. He's pulling. I know that's what he wants. So ho'omai on the inside and on the outside. Let me, I got something blocking. Okay, so yes, there is pule. What is pule to your family? In my family, it's puleakahaku. My great-great-grandfather of Hana Maui would always start everything with the Lord's Prayer. Meka ola aloha wa'evaleno. So the laxative plants, yes, you can do like you can do various hibiscus, ma'ohauhele, aloe vera, kukui, uhi, or the yam. And so depending on the assessment, the mili that you had done, how you had felt in the body, how does even the voice sound? You're even feeling how the voice sounds inside you. This vibration of the story that they're telling. Everything in me hears that story. So that will help me decide which of these plants I should do and whether you want this cleansing to go down or you want it to come up. Do you want to purge it up or do you want to laxative it down, right? So that information comes from the body assessment. There are cleansing teas, and yes, some plants don't work so well in a tea, like a mushroom is better tinctured. There are the steam treatments. Just to, if you're so weak, put a lot of the mea kanu inside a pot, boil it, put the towel over your head, and just steam it, right? To get that. And the external, still, pule ho'oponopono. Every patient has to decide what they're ready for. Are you ready to call in those healers that can work with the mental, psychosocial health, the ho'oponopono practitioners? I'm not this person. I support this person to work with that expert. Bathing, hot baths, Epsom salts, pa'akai. You can boil things on the stove, put it in a much bigger tub, and help heal the body like that. With steam, salt in the bath, and also go to the ocean. Why does it do that to me, people? Do you love it when it tells you you don't know your password? Okay, Kalamayau. So
No
you
problem.
gotta use these little things down here, but I don't know where they went. Let's see. Okay. So yeah, so steam bath. So what you can do is you can put things in the imu or heat them up and get lau maya, banana leaf, and banana stump, heat them up, then put yourself in a tent and let those hot items steam up if you don't have access to a kind of a more professional steam room. Go to the stream, prayer, stop and give thanks several times a day. I ask my clients to give thanks via all the five senses. What can you hear? Be thankful for the sounds of the birds singing, the waves crashing, the leaves rustling, the dogs barking, the children playing. What is in your sight? Give thanks that you can see, and what are all of these blessings? What can you feel? You know, what is the skin? What is apparent to the skin? What can you taste? What can you breathe in? Everything that encompasses, give thanks for that and stop for that. Then the lomi, absolutely. Popolo, very important. Partially because of the ritualistic aspect of Hawaiian being and daily ritual. It actually doesn't have scientific constituents that convey all of the healing that we as Native Hawaiians assign to it. It's mostly a beta carotene, which is very good for vision. But so what other people call placebo, right? We call faith. We put a lot of faith in popolo, in Solanum americana. And I have seen it work. I use it for wounds, but I don't find the evidence in the science. We find the evidence in the mo'olelo, and I'm happy with that. Some of the evidence comes from the science and some of it comes from the mo'olelo. Steam bath, and what I like to do for the elders is make the big pot of water boiled with the herbs, put towels inside, and then cover them. Put some kind of plastic protective on the mattress and then cover them and let them steam laying down. Let them take a nap inside the steam and let the healing steam heal. Not the oldest old can be safe in a sitting up steam environment. Ho'oko'olau, uhaloa, Wiltheria indica, also the nutritive foods like mountain apple, ohia'i, again, what Landon was talking about, mamaki, or ihi, the sorrel with the pink yellow flowers. And I wanted to include this stone because the body work is also enhanced by the natural environments. And so do you want the stone to infuse where the bones are suffering, where you need more hardness of the medicine? Do you want to use a bone tool? So here I am at home now. I'm gonna work on my next bone tool from some bone that was gifted to me by Mili on Lanai. So just to take in various kinds of herbs that strengthen the whole overall well-being, to nutrify, to move things, to function as adaptogenic, as vulnerary, to heal, right? And then ho'oino, to get the body moving. Same thing what Landon said, right? And so whether you're older and you do that by sitting down, moving the hands, vili kale, right? Learning with the elders. I can't tell you how many things are going through my body when I am making a lei with kupuna. you know, the face is smiling ear to ear, the hairs are standing up on the back of your neck. You know, you keep leaning in to hear what they have to say. You don't even know you're doing it, but their leo calls to the ancestors behind you, to the sides of you, to also join in the lei making. Lomi the babies, let them grow up saying, when I was small, my tutu used to call it pehu. When I was small, my tutu would go and get koali, right? For all of the things, bone, tendon, muscle, right? Let them know that. Let them hear these words. I'm super thankful. Engage in the songs, the hula dancing, the pahu, right? If you're not the dancer, if you're not the singer, you can still enjoy. You can learn from the mo'olelo. You can benefit just from sitting on the grass. Just from being present, we can start to heal. I have a sunset here. Still, acknowledge the five senses and give your morning prayer and your evening prayer a time to create daily ritual, right? That's part of what Landon is talking about, how we get ourselves to a strong place. It's a very modern time now that I can go to Landon and say, oh, I'm overweight and I have this and I have that and I'm smoking and how you can fix me, right? So before we would go to kahuna la'au, kahuna haha, right? We did everything we possibly could on our own. We want to demonstrate. We had worked hard. We did pray. We did go to the water. We did eat the whole foods. We did forgive one another, right? And still, eha, right? So, ola kino ole. It's not good, right? Ma'i. So then we ask others to please bring to us the help to, you know, throwing the net, working in the mala'ai, whatever we can do to just stay moving, to let the universe know that we accept kuleana for our part in it. The various herbs for the eha eha. So there's eha, but there's like all over any kind eha eha, right? Not just one. So yes, we know turmeric, but does this patient have heat now? I don't want to add any more heat inside. Something that maybe feels like a hot flash. If you took a temperature, you wouldn't feel heat, but the patient describes some kind of flustering up, pukaia, some kind of heat coming, right? So, and then next to that, I have a picture of the fascia, right in between every layer of the body. And when stagnation happens and sickness settles in, I have to feel where that is and decide what plant is for that eha that I feel in the body. These are the roots of ava, right? Calm, numbing. It's a neuroleptic. So helps calm the nerves down, decrease pain sensation, stretch with a partner, open up all of the fascia, and a partner helps you stretch past your capability. The nioi, chili pepper, the morning glory, koali, ava, and kineki or ginger. Also heats, lubricates, opens up spaces, moistens spaces, also very important. But then I would choose which one of these or which some of these after I started the body work. And then finally, at the end of the day, all of that, also what Landon's patient is talking about, right, is stress, significant stress. So passiflora or lilikoi, lemongrass, and at the bottom is I or bacopa, moneriaria. At the forefront of mental health right now, all things brain, all things memory. Right below the flower, Pua lilikoi is pohe kula, or pohe cola in science. Also Haui or blue vervain, and below that mamaki again, right? So any one of these, or put them together. And so I would say that it absolutely must have lilikoi and haui. One, lilikoi is really good to turn the brain off. The brain that wants to go to bed but won't stop talking, got to pick up the laundry, got to take the dog to the vet, got to pay the bills, got to do whatever, right? So she is specific to that. And haui, that pensiveness, that apprehension, that I think I'm gonna snap, I'm getting so exhausted, so frustrated, put that in there, and then add the other ones, maybe like lemongrass, just the fabulous fragrance of a lemongrass. By the way, also scientifically, lemongrass has no constituents for relaxation. Yet when you add it to this medicine, patients talk to me about really enjoying the rest they got. So not all of it is coming from the science. Oh, and then Landon and I, so here we come to an end. And I asked Kale Nuuhiva, what is the pule? So I am a student of Kale Nuuhiva at this time, and Katie Mele Mele, right, that Kamele Mele, that they are leading Pule Ho'ola every day of the week, and we are learning many new pule, were new to me. And when I asked her what are the pule that would be good for this kind of patient, she recommended elono. She recommended any of the pule that call in the water for this kind of sick patient recovering from COVID. So I am not trained I am not anywhere, I will confess, I am not anywhere trained anything like Kale. So Landon and I wanted to at least join everybody by the time the session is done, to just speak the words, to leave Dr. Pasqua with all of us still pulling on his ankles and pulling him back to health with Elono. Kale, are you?
Yes, hi.
So that's just his closing word, be not afraid. That comes from Dr. Pasqua. So if anybody has any questions, or, you know, we can do this at the end.
We just had a couple. Oh, so what I usually ask guests at the towards the end is if people want to find out more information. I mean, this was jam-packed with wonderful info, but if people want to find out more from either of you, is there a way to do that? I know you're an instructor, but can they contact you in some way, either of you?
Yeah, we're both available through Napu'uwai. And I'm also a professor at UH, and I can be reached. If you go to the directory at Windward College, there's only one Boyd on campus.
I would also add,
And then, yes.
I would also add real quickly that I feel very blessed for the opportunity to see patients on Oahu, Molokai, and Lanai. So residents on those islands, particularly Molokai and Lanai, can reach out to Napu'uwai for any care. And then on Oahu, I also work at Manakaio Malama, an integrative health center in Honolulu, for anyone interested in support.
And then for you, Landon, for your naturopathic health services, are services like that covered by normal health insurance?
So it's funny you mentioned that. Again, I feel like my entire career is nothing but a blessing, but I've been very fortunate to be a pioneer in many ways. And I was just recently, 3 years ago, the first naturopathic doctor in history to become credentialed with HMSA as a primary care physician. So,
Wow.
yes,
Congratulations.
my services are covered by most major health insurance plans outside of Kaiser, unfortunately, and Medicare and Quest.
Oh, great to know. Wow, right on. We only had one or two questions from the audience today. One, she had a friend and for herself were dealing with iron deficiency and was wondering, I know you mentioned alaya, but alaya is lepo, yeah? But what are other sources of iron for either people here or in the mainland as well? You said limu was good for that
Well,
as well?
right. Well, first I want to know why the iron deficiency, right? Are these women, do they have
Ah,
menstrual cycles? And at what point during the cycle are they low iron? And iron, the hemoglobin element of the oxygen molecule anyway, iron, heme, attaches to dark greens kinds of nutrients in the body. So I would also want to ask, what is your intake of the dark greens? If you can't hold on to the iron, then I would want to know about the dark greens. And I also have to assess the lung health because it's how you take in oxygen that iron can't attach if you aren't oxygenated. And if the blood isn't healthy enough to hold on. So yeah, there are some other assessments, but on the diet side, I would say lots of greens. So bulk up on your vegetarian lau lau, buy the poke that has limo on it, and then get yourself retested in a month.
all right. Thank you.
Landon, you want to address that question?
Sure. I would just add to that real quickly that again, health is complex, and it's very important that a skilled diagnostic approach is pursued with each individual, because there could be a number of different reasons why someone might be deficient in iron. And the very first thing, which is the scary thing that always needs to be ruled out, is anything that might be contributing to significant blood loss. So again, it's very difficult to just give a recommendation for a symptom when, again, we don't know the cause of what's driving that deficiency in the first place.
Right. Thank you for clarifying that. And I'm glad you guys made the disclaimer earlier. This is not for our viewers. This is not just a shopping list. You go and go for it. This is just a perspective. And we do encourage you, if you're going to, take a different approach to your health, which we encourage, to also seek help from people who know what they're talking about before you jump into anything new. I think that's all the questions we have. Any closing thoughts for our audience out there or in our Hawaiian community, especially our men?
Yeah, like Landon was saying, be courageous, seek someone to talk to, and whether that's in the traditional space, the naturopathic space, the full-on Western space. Yeah, the healthcare that you do now is healthcare for the future generations.
I would also add, this was actually one of my resolutions for Piko Wakea, and I'll be happy to share it. But because of the state that we are currently living in, I think it's really important that we are finding the opportunity in all of the obstacles that we are faced with every day. And when doing so, we have the ability to alchemize adversity into something that is uplifting and something that is productive and something that is of value. And this webinar series, Huewai Ola, is a fantastic example of that. It's almost another cultural renaissance of sense. There's so much amazing free Hawaiian cultural ike that is being shared right now. And we need to all be doing more of that. And again, finding the opportunity in all of the obstacles that we are currently faced with.
Well, I want to thank you both for spending some time with us this afternoon and sharing this. Wow, what a massive amount of ike and insight. But you made it really digestible for our community. And I like the fact that you're saying before you just go in a certain direction, start with yourself at home. Very simple ways to improve your health in your own household. And I think that's a great naturopathic and a great Hawaiian way to approach your health and the health of your family and your keiki as well. So I want to say mahalo nui to Kamailani Boyd and Landon Opunui. Mahalo nui for being our guests today on behalf of Huewai Ola. We really appreciate your time. Mahalo nui.
Thank you. Thank you.
We're going to do a few announcements to conclude our episode this afternoon. Thank you again for joining us. Be sure to tune in to our other Kanaio Kana online programs. Kamailani, if you could stop your screen sharing.
Okay.
And then we have a couple of slides that we're going to put up. All right. Wonderful. Is that okay, Kanani? Okay, again, be sure to tune into our other Kanaio Kana online programs, Lea Nue Nue, Aloha Rising, Kua Kanaka, Aikole. Like Landon Opunui was saying, there's so much content out here, and it's all free, and it's all for you. So take a moment, take some time. All the episodes are living on the Kanaio Kana page, so go check them out. We also have Aha Opio and Aha Keiki for our teens and our kids. Great episodes that you can look back on as well. Be sure to follow us on Facebook and Instagram at Ahakane and Kanaio Kana. We'd like to say mahalo nui to our sponsors that make He Huewai Ola possible. Ahakane, Kanaio Kana, Hawaii Tourism through the Kukulu Ola program, Papa Ola Lokahi, and the Consuelo Foundation. During this pandemic, we want you out there in our community to remember that there is help for you out there. You are not alone. If you need assistance, all you need to do is reach out. We have food drives available, and on this page right here is a contact information or websites for each island. So please, no shame. If you need help, check these websites out, and they'll be there to assist you. Also, if you need someone to talk to, here's some contact information, especially during these times of COVID and lockdown and these unprecedented times of 2020 that we're all going through. But we're going through it together, yeah? It's a kako thing. Otherwise, if you have time, please help us improve by taking a short survey. We'd love to hear from you. Again, my name is Kale Chang. Thank you for joining us. We're here every Friday, 2 p.m. on Kanaio Kana's Facebook page or website. Thank you for joining us here at He Huewai Ola. We'll see you next Friday. Mahalo nui and aloha.
Aloha.
Aloha.